Hello, this is a presentation about health center, the e-governance of health center. Now, first of all, let us know what is e-governance. We can define e-governance as use of information and communication technology, which is very essential for good governance. The application of ICT in governance is termed as e-governance. Therefore, we can say that e-governance is a ICT assisted good governance. Now, University Health Center. Let us examine the structure of it. The structure consists of outpatient department, pathological test department, specialized services, ECG, mental health counseling, AIDS, medicines department, issue and store. Now, what are the uh, what are the doctors attending this? They are consultants or specializations. Under this, it's eye center, dental services, orthopedics, mental health, cardiology, gynecology, ENT, and medicine. Now, under outpatient department, we have chief medical officer who supervises the medicine department and referral services. Then doctors on duty. Then consultants, specialists on duty. Then pathological testing department, ECG, homeopathic center, counseling services, AIDS awareness, and mental health. Now, doctors on duty. On duty, the doctors are, first of all, chief medical officer who is in charge, medical officers, and consultants specialists. Now, staff on duty, senior lab assistants, medicines attendant, medical store in charge, ECG attendant, counselors, helpers, and cleaners. Now, what is the hierarchy under which the whole center works? The whole center works under one rector who is the in charge of the health center. Now, rector supervises the work of chief medical officer. Then, chief medical officer supervises office superintendent, doctors. Under doctors, medical officers, consultants, homeopathic doctors. And he also supervises office superintendent. And in line, it is storekeeper, lab assistant, ECG assistant, helpers, and cleaners. Now, what is the medical workflow? The medical workflow is depicted as registration of a patient, appointment with a doctor consultant, consultation and referral for attached hospitals, writing a prescription, dispersing medicines, and pathological testing, ECG, counseling, and first aid. Now, what is the administrative workflow? Under administrative workflow, we have policy making, rules and regulations, meetings and teleconferencing, and phone conferencing, human resource management. Now, let us examine what is the present manual governance. Under present manual governance, patient consults a doctor consultant without prior appointment. Doctor examines his medical booklet, writes details in a register, examines and writes prescription in the booklet, and also writes a slips prescribing medicines, pathological tests, and referrals. Patient collect medicines, visit lab for tests, visits referral hospitals for treatment. Now, if we want to do e-governance, then what we will do? We will be making a web-enabled software. The software has to be installed and linked with all computers in the center. Relevant data is entered in a specific databases. All modules are to be linked. वो कैमरा से दिखाई नहीं पड़ रहा।